There is a great deal of anxiety in our city, across our country, and indeed around the world about the effects of the coronavirus outbreak. Nothing quite like this has happened in our lifetime, so it is quite understandable that people are on edge. I'm here today to provide an update on the city's latest efforts to help you and your family stay informed, to prepare yourself and your family, and take actions to stem the spread of the virus. I want to begin by saying that the virus is coming, if it's not already here. While there has yet to be a confirmed case in Greater New Bedford, we should not be fooled. As has been widely chronicled, the limited number of test kits in the United States has inhibited the ability of the medical community to determine with confidence who has been infected. As we know, based on the recent outbreaks in China, Italy, and other places, the virus has the potential to spread faster than our healthcare system can effectively address. Our work has been here in the city has been focused on three general priorities: to slow the transmission of the virus in our city and our region, to make preparations to continue essential city services, and to ensure the health and safety of our city employees and our residents. The strategy is to flatten the curve of viral spread. That is, to slow the transmission of the disease so that our healthcare system can keep up with the flow of patients until the virus eventually peters out. Getting out ahead of the virus through appropriate social distancing and encouraging proper hygiene is essential. That is why, even though residents in our region may not be infected yet, we have been taking proactive steps, including the recent canceling of the New Bedford Half Marathon. Our decisions are informed by the advice of healthcare experts and are consistent with the guidance from federal and state agencies. Every morning I am briefed by our health director, DAMON, CHAPLIN, who is here today, from whom you will hear shortly, along with our public safety agencies on the latest developments, so that as the situation evolves, we can make informed decisions in the public interest. Under the authority vested in me under law, I have declared a state of emergency now exists in the city of New Bedford. The authority allows the mayor to suspend certain rules concerning the procurement of goods and services, and generally affords the mayor the ability to take reasonable steps to ensure public safety. With that in mind, here are the latest steps we intend to take. Concerning public events, all non-essential public community events greater than 100 people will be postponed or canceled. In particular, the mayor stated the city address, which is the second largest of its kind, event of its kind in the state, will be postponed. And I appreciate that the South Coast Chamber of Commerce's understanding of that decision, as they are the host of that event. And I just want to acknowledge Rick Kidder, the executive director. Concerning special event permits, all special event permits will be reviewed by the health department. This will be re-reviewed, but effective this Monday, we will revoke all permits for indoor activities greater than 100 people, and all other special events will be subject to review of the health department to assess the risk of transmission. Concerning school events, the superintendent has announced a similar curtailment of school events, and he is here today, and he'll come up here in a moment to speak. I want to acknowledge and thank the decisions by the New Bedford Whaling Museum and the Zeiterian Performing Arts Center. Rosemary Gill, the executive director, is here to suspend events and both of those key cultural anchors in our city. It was in the public interest to do that. With respect to other events that do not require some public approval, I strongly discourage the holding of non-essential indoor events of greater than 100 people. Concerning city facilities and board meetings, in addition to curtailing events in public places, certain facilities will be closed. Effective Monday morning, all senior centers in the city will be closed until further notice. Likewise, we are closing the adult day facility in Brooklawn Park, but will provide the families of the facility's patrons a reasonable opportunity to find alternate care during the day. Buttonwood Park Zoo, concerning the Buttonwood Park Zoo, all indoor events will be postponed or canceled for the foreseeable future. The zoo itself will remain open, but obviously that's another place where other mitigating measures will be considered. Concerning boards and commissions, last night the governor issued an executive order that liberalizes the requirements of the state's open meeting law. Our attorneys are reviewing that order now, but in any case, we will take every step consistent with the law to minimize the attendance of board and commission meetings, including the deferring of items for which board action is not urgent. As far as our city employees go, we are working hard to ensure the safety of our employees. For starters, our custodial staff, and you've seen them working here in the library, is strenuously cleaning buildings, and we are emphasizing, of course, proper hygiene at all times. All out-of-state employee travel through the end of April will be postponed or canceled, as well as any non-essential employee travel greater than 20 miles. The superintendent has announced a similar curtailment of school field trips, and he'll describe that for you. We are telling our department heads that employees whose duties and responsibilities to allow them would accommodate work at home should make arrangements to do just that. And our MIS department is working to make those changes easier to make. In a similar vein, to help protect our employee health and that of our residents, I strongly urge everyone to pay their city bills online. Please don't come into City Hall if you don't have to. We get online. It's easy to pay your bills that way. We're really trying to minimize the public interaction with city buildings. And I strongly encourage all employers, private sector employers, to employ similar protections and accommodations for all of their employees. As far as schools go, we've seen that a number of places around the country have already canceled school. We are continuing to look at the safety of our schools. We're not making any general decisions about schools at this point. The superintendent will tell you a little bit about what has already been implemented and is being implemented. But right now we have no general announcements about schools right now. Let me just say this in general. This is one of those challenges that our city and country faces in which the actions of private individuals is indispensable to our success. Government can't take care of business all by itself. More than anything else, and this just bears constant repetition and practice, proper hygiene is a must. Wash your hands thoroughly and frequently with soap and hot water. Make sure your loved ones do the same, especially your kids. Be especially conscious of what you touch. Avoid as much as possible highly touched surfaces, such as railings, doorknobs, and elevator buttons. And as you came up here, I can tell you that our staff is scrubbing away at those things as they are across all of the city's buildings. But if you can avoid touching it, don't do it. Don't touch your face. Think about your hands, right? These are the vessels through which much disease can be spread. So be very conscious of what you touch, including hands, others' hands. Stop shaking hands. You saw us do elbow bumps on the way in. Elbow bumps are fun. Everybody do elbow bumps. All of these measures and more, along with links to relevant state and federal guidance, can be found on the city's website. We'll continue to push out more updates so that you and your family remain informed, and I ask that you share it all with others. Our work here is about serious preparation. It's not about panic. Each of us has a role to play to ensure the health and safety of our fellow New Bedfordites, every one of us. I thank you in advance, each of our residents, for your understanding, but more importantly, for the role you will play in this collective effort. And with that, I'm going to ask Superintendent Thomas Anderson to come up to say a few words about what we're doing in the school department. Thomas.
Thank you. Good morning. So we know that there's a lot of anxiety about the current situation that we're in, and we are working collaboratively with the Mayor's office, the Department of Health, and any of the other offices on the state level as well, because it's very fluid. So some of the things that we're doing, consistent with what Mayor Mitchell had just shared in terms of some of the events that we'll have. Right now, we'll still continue with our field trips for students that are in the greater New Bedford area. So there are some that would travel a little bit further out. We've decided, because of the locations that they were going to, that those trips will not be taking place. We will continue to review and look at all of the information that we have through April 30th. So consistent again with what the city is doing with some of the large gatherings. We have several events that would be scheduled at schools, whether it's a dance or other type of opportunity students have to get together. So we'll be sharing that with parents that we will not be we'll be able to reschedule a lot of those events. In terms of out-of-state travel for conferences and those type of things for staff, again, through April 30th, we're canceling all of those events, those opportunities. Many of them can be rescheduled. Many of the conferences that we would have been attending, they have already canceled. So it's made that situation a little bit easier for us to be able to address. And the other item in terms of, it is a very challenging situation. What I do want to reiterate is that we've been focusing on getting our buildings clean for the last several weeks in terms of doing a little bit of extra care. We've had staff that has been coming. We compliment our building service staff, our custodial team, of coming in on the weekends, on those Saturdays, sometimes on those Sundays, in general, before the outbreak has spread as it has. Doesn't mean there's not a level of anxiety there, and we're being prepared in the event that we have to do something different, where students may have to do some remote learning. But as of right now, we're still in session as we plan to be. But I just want to ease some of the concerns that parents may have in thinking that the buildings are not clean or we're not putting forth a serious effort to make sure that that part is taking place. We jumped out in front of that earlier. If when we think about each year, we talk about the flu, and telling our students to make sure that we're covering up, we're washing our hands, and is following all the guidelines that we receive. We had those conversations in November and getting into December through school committee meetings, information that I would send home, different letters. Principals have those conversations individually with their students throughout, and their staff. So we were proactive in terms of just thinking about how do we not spread germs in general. And as we get into the situation that we're in, it is, again, a level of anxiety about what we do in terms of our schools. But right now, we believe that we're in the judgment of working with our health department, those individuals, that's the guidance that we're taking. And I was on a call earlier today with the Commissioner of Education and the Commissioner for the Department of Health for the state of Massachusetts, along with several other superintendents. And they gave lots of scenarios and those type of things just to reiterate the point about what are the things that we need to do to be proactive. They're not sanctioning a statewide school closing. They're still leaving it up to the local districts. And so people can second guess and do some of those things, but we have to really lean on the side of what's in the benefit, what's in the best interest of our students. And my main concern is making sure that our students are healthy, making sure our staff is taken care of. So I want to make sure that people know that we're not going to stay in session for the sake of staying in session and jeopardize the health of individuals. So we're working a lot with the other teams to make sure we cover everything.
Okay, thank you, Thomas. Next, I'd like to call up DAMON Chaplin, our city's Director of Public Health, who is running point on all of these matters on behalf of the city and who's acting as the conduit for our collective decision-making. DAMON.
Thank you, Mayor. I think Mayor Mitchell has covered many of the topics that we've been discussing privately within city government around flattening the curve on this pandemic now. I think it's important that we reiterate, if you're not feeling well, to stay home, practice social distancing when it's appropriate, practice good hygiene, and also using good coughing courtesy when amongst friends, families, and the community. I think the mayor had also talked about the health department helping to make those judgments around private events that are happening that may be greater than 100 folks. That criteria that we'll be looking at, those events, will include the nature of the event. If the event will allow folks to practice good social distancing, we will also be looking at the necessity of the event and then the vulnerable populations as well. And so it's important that we stay nimble as this epidemic, this pandemic continues to increase throughout the country. Although we have no confirmed cases in New Bedford as of yet, it's important to practice those good hygiene practices going forward. We're working with the state to evaluate those confirmed cases within the city. We're also working with our communities and our local agencies to also help implement some of these practices. And so, again, we cannot reiterate enough until we get more data, more testing. Again, if you're not feeling well, please stay at home. Practice social distancing when you can. Practice good hand washing and personal hygiene, and implement cough and courtesy when you're amongst others.
All right, thanks, Mark. So I wanted to lastly call up Dr. Matt Bivens, who's the Chief of Emergency Medicine over at St. Luke's Hospital on behalf of South Coast Health, with whom we are working very closely on a number of fronts. And I just want to thank South Coast Health CEO Keith Hovan for the great collaboration that the health system has established with the city. And there's a lot of work left to be done, but I wanted Dr. Bivens to come on up and say a few words from the perspective of the healthcare system.
Thank you. Hi, thank you. My name is Matt Bivens. I'm the EMS Medical Director for New Bedford EMS and Acushnet and Fairhaven EMS. I'm an ER doctor at St. Luke's Hospital, and I'm here with several people from St. Luke's South Coast. Dr. Anil Shukla, who's the chair of the emergency department at St. Luke's, and Brian Giorgiani, who's our EMS coordinator, and Dave Kamara, who's in charge of emergency management at the hospital system. We're working closely with the city to try and stay on top of this. It's still early. We don't know everything we need to know. Not to be repetitive of what others have said, but one important message is that we do not have broad testing for this right now. So you cannot come to the hospital expecting that you will be tested for coronavirus. You would only be tested per DPH CDC guidelines, which are very restrictive. You have to have come within the past 2 weeks from one of those concerning areas like China or South Korea or Italy, or you have to have like a known exposure history. Just having a fever and a cough is not enough for you to come to the hospital to get tested. You'll probably be turned right back around without being tested. And if you do have a fever and cough and you feel fine, you probably have influenza or another virus more likely than you have COVID-19. And even then, you should still stay home, not bring that to the hospital, don't visit your relatives in the nursing home, stay home until you don't have a fever. And when we know more, hopefully we'll get more broad testing soon and we'll be able to give you more information about what's going on with this virus in our area.
All right, great.
All right,
Thank you,
thank
Matt.
you.
All right.
Thanks.
Thank you. Just a couple of other things. Just in the way of dispelling some concerns, the New Bedford water supply is a very important city function, and it's something that we work hard to maintain the integrity of. I can assure you that there are treatments at the plant that deal with viral exposure, and there is no reason to believe that there's any risk there. The health department will be doing rigorous health inspections as much as we want voluntary compliance and to get everybody on the same page. You're a major employer. If you're somebody where there is a potential for exposure, you're probably going to get a visit from somebody from the health department. We really want to make sure that everybody is sitting up straight and doing what they need to do to prevent exposure. I do want to say one thing, because we are New Bedford after all, and this is the center of the seafood industry on the East Coast. The Food and Drug Administration has said that there is no evidence to suggest any connection between seafood and the coronavirus. I say that only because there are rumors out there, and there are lots of rumors out there, but one of them is that there's some connection to Chinese seafood, and I'm here to tell you there's no, based straight from the FDA, and you can find it on the FDA website, there's no evidence of any connection at all. Let me just introduce everybody who's up here. One other thing too, with respect to small businesses, if you're a small business and your concern, as you understandably would be, about the hit on your bottom line as a result of the outbreak and the precautions taken in the face of the outbreak, then you should call the Economic Development Council. The Economic Development Council, headed up by Derek Santos, is dealing directly with the Small Business Administration, which has freed up resources that may allow, facilitate the small businesses getting through what may be a rocky patch. The other thing I just want to do is there'll be other announcements to come for sure. I mean, everybody should stay alert and spread the word. We will continue to update as time goes on, certainly next week. But you can always go to the city's website to find out more. I do want to introduce everybody on the city side here today so that folks can understand what the scope of the effort. So just from my right to left, Fire Deputy Chief Scott Kruger, Fire Chief Paul Cordair, Police Chief Joe Cadero, EMA Chief Brian Nobriga, and then obviously DAMON Chaplin, our Health Director, our Director of Facilities and Fleet Management, Mark Champagne, Deputy EMS Chief Mike Thomas, and of course you've met the Superintendent Thomas Anderson as well. So with all that, I'll open it up for questions.
Mayor, how about graduations? I know that's in May, but can you comment about that?
Correct. No decisions there yet. Those graduations, at least actually both our major high schools, are outdoor events, and they're also in June at this point, so we're not prepared to make any decisions as yet. But again, this is, I'll just emphasize this to everybody, you know, this is an evolving situation. That's why we have daily briefings and things are changing. You know, I'll give you an example. I was interviewed by a Wall Street Journal reporter yesterday about our decision to cancel the half marathon, and you know, we were, you know, as sporting events go, we were further out ahead than a lot of places were in making that decision. But you know, events have greatly surpassed everybody since then. It just seems, looking back at it, it seems like a total no-brainer now that the NBA and the NHL and Major League Baseball and the NCAA have shut down things. So, you know, this. I mean, as all of you know in the media business, this is a you know, a rolling set of events, and we in city government, as you can see here, you know, will remain on top of it and on a daily basis as we must.
We've been receiving reports that students are going into bathrooms and there isn't soap and sanitizer and possibly hot water. Has that been an issue, or has that been addressed?
Not that I know, but I'll have the superintendent come on up and address that directly.
Thank you. We do daily checks. So there's a checklist, there's a process, there's a system that the building custodial workers have, where at this point they're checking our bathrooms on an hourly basis. So we're good with supplies, soap. There should be no issues with hot water. We're on top of it. In the event that something does come up, we have a team that's ready to go ahead and to take care of that.
Anybody else?
Would the two of you, Superintendent and Mayor, would you comment about the factors going into whether the school is continuing in the traditional format or whether it's done remotely?
Yeah, so I think it's that decision poses different challenges in different places. You know, there are some, and I'll just make a general comment, and I'll ask Thomas to come back up. You know, there are more affluent places that can do that more easily, where parents have internet access at home and the kids have computers at home. That's less the case here in New Bedford. Here in New Bedford, we also have a big part of our student population that relies on free lunches and free breakfasts. And so, again, you know, the demographics of our city are such that many kids rely on those meals every day. And so, you know, those things factor into the decision making as well. I'll just ask Thomas to elaborate.
And, you know, and like the mayor was saying, when we think about any type of closing, the same way we address a snow day, when we need to be mindful of those students that are dependent upon school meals and those type of things. So when we first thought about the potential, we have to be ready for it in terms of if they're in the event of closing. So it doesn't mean you're going to do it, but you have to be ready for it. So we've already been planning, and actually, as we're here right now, we have a team working on work packets. So hard copy information by grade level that in the event that we would have to close, they'd be able to get that out to all the schools, to all the students to take home. Students that have access to internet resources, computers, and those type of things, they would already have access to that. It's not the work that they would get is not dependent upon there. So when we think about equity and making sure that we've thought of that in the beginning, that was a clear defining point about what would we do in the event of that. And just the other areas that we need to be mindful of in thinking about a closure, again, the same way we think about it on a snow day.
Go ahead, Mike.
How long will the state of emergency be?
Until further notice, so no ending date. And again, it's, events are very hard to predict, and that's why we have to stay on top of it all the time.
Now, when people pay online, will the fees be waived because of the emergency?
Well, the fees will be what they are. If there are opportunities to make it easier, then we'll certainly look into that.
Can you reiterate the city's plans for senior facilities, and then also possibly, if you can, elaborate on what the Small Business Administration may be able to provide for some local businesses?
Right, so the city has 3 senior centers, and so effective Monday, they will be closed. The city also runs an adult day facility, which was once an ordinary senior facility. And at that facility, there are adults, mostly elderly, who are cared for. And the decision there is that we're going to shut that down as well, because the risk, we think, of keeping it open is too great for the good of, especially the good of the patients there, the clients there, as well as staff and all their families. So, but we also know that closing that down abruptly may be very disruptive to the lives of the loved ones of the clients, and so we're going to work with them to wind that down with all deliberate speed. But we also don't, we're trying to balance their needs and our effort to stem the spread of the virus. As far as the Small Business Administration goes, the Small Business Administration has made a number of announcements about short-term lending, and those details can be found on the Small Business Administration website. Our Economic Development Council is coordinating, facilitating the small businesses here availing themselves of those benefits if they need them. Go ahead, Mike.
If parents don't send their kids to school, will those absences be excused, or is that something that's going to be taken into account?
Yeah, so the schools, again, I'll call the superintendent up for this. The schools are, our schools are safe. The school department, you've seen reporting of other school departments that have had to shut down to clean stuff up. And this echoes what the superintendent said, but our school department under his leadership got out ahead of that and has been scrubbing away and continues to scrub away so that we don't get to that point. Again, with respect to schools, closure of those schools, those decisions would be made, but schools are still safe places.
But
You want to elaborate?
concerned they decide not to send their kids, will those be something counted?
Because online right now, as we
Just
speak, there are
one-
dozens of people that are very concerned about the fact that you're shutting down events, but yet the children are in very close proximity. They're not shutting down the schools. So parents right now live are extremely concerned, and they want to ask the mayor why and the difference between the two.
Go ahead.
In regards to the absences, again, we always lean on the side of it's the parents. It's up to the parent if they with their level of comfort is in terms of sending their child to school. I can reiterate the fact that we are doing above and beyond to make sure that the buildings are clean, that we're keeping students in an environment that is conducive to learning, that is teaching them, and also having them on a daily basis, making sure that we're able to teach them a little bit more about how to cover up, wash their hands, and do all those types of things. In terms of the absences themselves, the state has said after March 2nd, districts will not be penalized in terms of the chronic absenteeism. So that, from a district perspective, is not that we're going to be penalized for the number of absences. So again, my focus is for students to be safe and to be taken care of. If parents feel as though they need to keep that child home, we're going to make sure that they get to work. Students will not be penalized for being absent.
Okay. All right, well, thank you, everybody, for coming, and again, there'll be updates as time goes on. Mary, last one, go ahead.
Two-pronged question, quick. When you declare a state of emergency, what powers does it give you that you don't normally have? And what's the standard under the law for declaring a state of emergency? Mary serves WPSM.
Yeah, in general, so it's not well-defined under state law, but in general, it allows the mayor, in this case, to suspend certain procurement rules so that we can get goods and services more readily and not have to put them out to bid for some period of time. That's probably the biggest one. You know, there is some gray area as to the extent to which we can take other measures, and we'll have that, you know, for the purpose of ensuring health and safety, and we'll make sure that our with every step that we think is necessary, we'll make sure that it gets vetted by our legal staff. So, anyway, thank you, everybody, for attending, and stay tuned for updates. Thank you. Thanks, guys.